You know that feeling, healthcare? It often feels like this massive, complex system,
Mm-hmm.
expensive, confusing sometimes, and honestly, just pretty overwhelming to deal with.
Definitely.
And maybe lately you've noticed some really big, familiar names entering that space. Companies you usually think of for, I don't know, getting stuff delivered fast.
Right, like Amazon.
Exactly. They're stepping in, promising convenience, speed, a whole different experience. Makes you wonder, what's really going on.
It's a huge shift, isn't it? You have companies like Amazon applying what they're good at, logistics, customer-focused tech, to healthcare.
Yeah.
They see issues and they're trying to, well, disrupt things.
Yeah.
But the big question, the one lots of experts are asking, is does this actually lead to better health for people? Or is it mostly about finding a new market?
And that's exactly the deep dive we're taking today. We want to peel back the layers on the promises and, yeah, the potential perils, too, when these tech giants get into healthcare. So we've dug into a bunch of sources analyses from Harvard Business School, great reporting from Stat News with researchers from UCSF and Yale.
Yeah, physician data scientists, which is interesting.
Right. Plus research from the Commonwealth Fund, Duke Margolis Center for Health Policy, University of Wisconsin's Poverty Institute, Brookings, Amazon's own stuff, and some specific investment case studies.
Quite a stack. And our mission really is to unpack Amazon's specific angle on healthcare, look at the challenges it's up against,
Okay.
and maybe most importantly, introduce you to a framework that investors and health experts are working on. It's about figuring out if private money coming into healthcare actually delivers real value for patients, for communities.
Especially for those who need it most, right?
Exactly.
Yeah.
Especially for the most vulnerable.
All right, let's jump in. Amazon strategy. The sources are calling it manufactured care. What's that actually look like?
That's a pretty good term, actually. It captures the idea of taking healthcare services and kind of packaging them like products.
Like ship.
Sort of, yeah. Applying that same thinking modular, frictionless, fast to medical stuff, using their existing infrastructure to streamline access.
Okay, so you see that in things like the One Medical clinics they bought.
Right, the membership clinics.
And the $5 RX pass for generics, the telehealth visits you pay for directly, AI for sorting out symptoms, tools for benefits.
All about standardizing things,
Yeah.
making it quick and easy, often trying to, get around the usual insurance hoops where they can.
So Amazon Clinic is a prime example.
Yeah, exactly. It's their virtual care service. You go online, describe a common issue like pink eye, sinus infection,
Right.
answer some questions, a clinician reviews it. Or for slightly more complex stuff, there's a video option.
And the pricing that stood out in the sources, it's upfront.
Totally. You know the cost before you start, like maybe $29 for a message-based thing, $49 for video, no big surprise bill later.
That's huge.
And the clinician gives you a plan, sends a prescription to any pharmacy, including Amazon Pharmacy, of course, for delivery. Plus, you get follow-up messaging for like 14 days.
So it feels like ordering. Well, anything else online.
That's the goal. Quick help for a minor thing, immediate, transparent. That ease is core to the manufactured care idea.
Okay, so that's the how and the convenience factor. What other potential upsides did the sources point to?
Well, that price transparency we just talked about, that's a big one compared to hospital bills.
Oh, yeah, no comparison.
It's a definite plus for the consumer experience.
Makes sense. And what about their data? They have a lot of it.
That's another potential promise. They got EHR data from One Medical, pharmacy data, consumer data. The sources suggest this could potentially be used for things like spotting if people aren't refilling meds, or maybe helping manage chronic diseases by looking at lifestyle patterns.
Interesting. But also raises privacy questions, maybe.
Oh, absolutely. That's a
Well,
whole other dimension.
Uh,
But the potential for integration is there.
and the digital-first approach seems to appeal to certain groups.
Yeah, younger people, maybe gig workers with fluctuating insurance, they value that flexibility, the on-demand aspect, and using their AWS cloud platform like some health systems are doing.
Right, like Froedtert and Medical College of Wisconsin.
Exactly. That shows these kinds of services could potentially scale up really fast.
Okay, so there's a clear vision. Convenience, transparency, tech efficiency. But let's pivot to the challenges. Where do the sources say the big perils lie?
Right, this is where it gets complicated. That manufactured care model
Mm-hmm.
works okay for routine stuff, right? A checkup, a refill, a simple diagnosis.
Mm-hmm.
But it hits a wall with serious complex health events. Think surgeries, managing multiple chronic illnesses, dialysis, cancer treatment.
Mm.
Those just don't fit the model.
They're not modular pay-per-visit things.
Not at all. And the cost explodes way beyond what this approach covers.
Which brings up the financial risk, especially for people without good insurance. Exactly. Kaiser Family Foundation research highlights this many uninsured folks are already struggling financially. If this model pushes the cost of really serious care onto individuals,
That could be devastating.
potentially ruinous, yeah. Then there's this major issue. Stat News dug into, they call it the data gap problem.
Okay, what's that about?
Well, Amazon bought One Medical, saying they want to reinvent healthcare, right? Which suggests using data for innovation.
Makes sense.
But the stat analysis involving those UCSF and Yale researchers looked at where One Medical's actual physical clinics are.
What did they find?
They found the clinics are overwhelmingly located in affluent, predominantly white, highly educated urban areas. They use this measure, the Area Deprivation Index.
Right, I've heard of that. It looks at neighborhood factors like income, housing.
Exactly. And One Medical clinics were clustered in the top 10% least deprived communities in the country.
Wow. So not exactly representative of the whole population.
Yeah.
Not even close. And the implication is pretty clear. The patient data coming primarily from those clinics, it's likely missing huge chunks of the population, lower income groups, rural communities, diverse racial and ethnic backgrounds.
Creating a data gap.
A significant one.
And why is that gap such a big deal if you're trying to innovate in healthcare?
Because if your main data set only reflects one specific, relatively privileged group, you just can't see the health needs and disparities faced by everyone else. You can't design solutions that work for all communities if you don't have data reflecting their realities.
You're flying blind for huge segments of the population.
Pretty much. And it could make existing problems worse.
How so? How could this skew actually worsen disparities?
Well, think about it. If Amazon's physical clinics and main data source cater to wealthier areas, while their virtual care becomes, say, the main option for people losing Medicaid, you could end up widening the gap, pushing lower income or rural folks towards virtual-only care, which, as research from Wisconsin shows, only works well if you have reliable broadband and clear reimbursement, things that aren't universally available.
So access isn't guaranteed even with virtual options.
Not necessarily effective access, no. And speaking of hurdles, the sources also flag major regulatory challenges.
Like high pay.
Privacy.
Exactly. High pay is huge. Patient data is incredibly sensitive. And then there are antitrust concerns, worries about a giant company dominating the market.
These are bigger problems for Amazon than for a small startup, presumably.
For sure. They're under a much bigger microscope. Remember Haven, that earlier healthcare venture with JP Morgan and Berkshire Hathaway?
Yeah, it dissolved.
Right. Navigating these regulatory waters is tough.
So a key question then is, who really benefits most from this model as it stands?
That's a concern raised in the sources. Individuals needing quick, convenient care for simple things. Sure, they benefit. But the model might mostly attract healthier people.
Leaving the sicker, costlier patients for who? Potentially for states, for traditional safety net providers. Meanwhile, Amazon shareholders obviously benefit from One Medical subscriptions, pharmacy sales, the logistics side, and potentially the value of all that health data they're gathering.
Okay, so we have this picture. Super convenient, tech-savvy for certain needs, but facing real questions about comprehensive care, equity, and reaching everyone.
Precisely. And that tension, innovation, and profit versus truly improving health for everybody is driving this really important conversation now among investors and healthcare folks.
About how to make sure all this private money flowing into healthcare actually does good.
Yes. How do we ensure it actually moves the needle on health, not just on financial returns?
And this is where that Duke Margolis Center work comes in, right? Building a bridge.
Exactly. They've been leading the charge on developing this health value return on investment framework, HVROI for short.
HVROI. Okay.
It's basically a structured way for investors and companies to deliberately connect financial goals with creating real health value.
Why is something like that needed right now?
Well, private investment is key for innovation, no doubt. But it's also faced criticism. You've had investigations, like by the Senate Budget Committee, looking into cases where, private equity focus on profits might have hurt patient care or access.
Right.
So there's this growing sense that we need better tools to make sure investments are aiming for both financial and health goals.
So how does this framework define health value? It sounds like it's broader than just, did the patient get better versus what did it cost?
Oh, much broader. It builds on established ideas like the Institute of Medicine's quality dimensions, safety, effectiveness, patient-centeredness, timeliness, efficiency, and, crucially, equity.
Equity is built right in.
Yes, and the HVROI framework really stresses that value has to include the patient and caregiver perspective, what actually matters to the person getting the care.
Okay, so what are the main parts of this HVROI framework? How does it work?
It's got two core components. First is the health value model and evidence. This happens up front when considering an investment. It asks the basic question, why do we think this investment will actually improve health?
Okay, the rationale.
Right. And what's the evidence? Research studies, pilot data, expert opinions, whatever supports that theory. And you have to think about impact across different areas: patients, outcomes, access, cost, equity, providers, payers, the community, how it affects disparities, and how well the money-making part lines up with the health-improving part.
So laying out the theory of change,
Yeah.
basically, and backing it up.
Exactly. Then the second part is the health value key performance indicators, HVKPIs, and an assessment plan.
Some measurable goals.
Yep. Specific metrics linked directly back to that initial model, things you can actually track over time.
Like what kind of metrics?
Could be clinical results like blood pressure control rates, could be access metrics, patient experience scores,
Yeah.
how healthcare is used, spending trends, and really importantly, measures related to health equity. Are we closing gaps?
And a plan to actually track them.
Right. And ideally be transparent about the results eventually.
This feels important because how investors measure success really shapes what gets funded, what kind of innovation we see, and ultimately what care is available to us.
It absolutely does. If profit is the only metric, innovation optimizes for profit. If health value is also a core metric, you potentially get different, maybe better kinds of innovation.
Yeah.
And to make this less abstract, the sources shared some case studies. Companies actually trying to do this, connecting their business success to health outcomes and equity.
Okay, let's hear about those. There was one focused on chronic disease and food.
Right, Attain Health. They partner with health plans to provide medically tailored meals and nutrition support, often for Medicaid members with chronic conditions like diabetes.
Addressing food insecurity as a health issue.
Exactly. And they track KPIs showing it works. Like, they report a 70% reduction in blood pressure for their diabetes patients. And for the health plan, they see members sticking around 89% say they're likely to re-enroll because of the food service. It shows how tackling a social need improves health and helps the plan's business.
That's a clear link. What about in behavioral health?
Sober Sidekick was highlighted. It's a peer support app for substance use disorder. The core idea is community support for recovery. They track how peer interaction impacts things, reporting that just one interaction cuts relapse risk significantly, by almost half, and they estimate real cost savings, around $8,000 per engaged member, by keeping people healthier and avoiding crises.
So linking community support to lower costs. Interesting. What about complex care for seniors?
WellBealth is an example there. They use the PACE-E model program of all-inclusive care for the elderly. It's for seniors who qualify for nursing home care but want to stay home. Their KPIs show high satisfaction, like 94% report better quality of life. And clinically, big drops in hospital use 9% fewer admissions, 14% fewer ER visits. Plus, they hit strong quality targets, like for diabetes control. And it costs less, about 12% less than the state would typically pay for that population through Medicaid.
Wow. So better care, better experience, and lower cost.
That's the goal of integrated care models like PACE-E.
And one more example, tackling severe mental illness.
AMI Health.
Yeah.
They focus on integrated outpatient care for conditions like schizophrenia, bipolar disorder, folks who are often hard to reach.
Very challenging population.
Extremely. But their KPIs are impressive. They get 80% patient engagement, much higher than usual standard care, which might be like 30%. And that engagement translates into huge drops in ER visits. 30-day readmissions fell from 23% down to 4% in their model. And clinically, big improvements. 60% better medication adherence, 50% reduction in severe symptoms like suicidality or psychosis over 24 weeks. It really shows intensive integrated care can work wonders, even for the most complex needs, and prevent those high-cost crises.
These examples really drive it home. They show companies trying to prove they're making a real difference in health, not just profits, sometimes specifically for vulnerable groups.
They definitely show the potential. But, applying these HVROI ideas consistently across the board, that's still hard. We need more standard tools, better data collection.
And how does this focus on measuring health value help with that data gap problem we talked about with Amazon?
Well, because the framework requires you to think about equity. It forces you to include disparities in your model and set KPIs to track if you're reaching diverse groups and if they are benefiting.
So you can't just show an overall average improvement if one group is being left behind.
Exactly. It pushes for that deeper look. Are we helping everyone or just some?
The sources also mentioned it's not just about the framework itself, but also the people involved.
Oh, totally. The successful initiatives often have diverse leadership, people with lived experience of the problems they're trying to solve. And they build incentives into the system to serve underserved populations, not just rely on good intentions.
Makes sense. So pulling this off really needs everyone working together.
Absolutely. Investors, companies, payers, providers, policy folks, they all need to collaborate to build the infrastructure for doing this kind of health value assessment reliably.
Okay, so let's wrap this up. We've seen Amazon's vision, this very convenient, logistics-focused healthcare, great for routine stuff, feels fast, like ordering online.
The manufactured care approach.
But we've also dug into the real challenges, limitations with complex care, big questions about equity, and that critical data gap potentially skewing solutions away from those who need them most.
Right. And then on the other side, you've learned about this growing push from investors and companies to measure actual health value, not just financial return, using frameworks like HVROI.
And we saw those concrete examples, companies tracking clinical results, equity impact, cost savings, often for complex conditions or underserved groups.
It shows a different path as possible.
So how private money gets invested in healthcare, and critically, how success gets measured. It directly shapes the kind of care you and I have access to, how fair it is, and whether it genuinely improves health for everyone.
Which leaves us with a big question to chew on, doesn't it? If private investment is going to be a major driver of healthcare innovation,
Yeah.
who's ultimately responsible for making sure that convenience and profit don't end up overshadowing the need for comprehensive, equitable care, especially for the most vulnerable? Is it up to the investors, the companies themselves, or do we need policymakers to step in and create the right incentives and guardrails?
That's definitely something to think about. Who ensures health value for all?